You're watching Heart to Heart on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A York County woman knew something was wrong. She was having a hard time breathing, but she didn't want to believe it was her heart.
I enjoy the outside. It's just something gratifying about being out here. It's wonderful to me.
On cold winter days, 73-year-old Darlene Reimel Harner is outside working. She loves this kind of work, but this hard work became too much of a struggle for her.
I was experiencing breathing problems. Doing things became harder and harder because I became so short of breath that actually I expected that I wouldn't make it too much longer because it was getting pretty profound.
Darlene's mother and grandfather had heart problems, and both died from heart disease.
My mother had angina, so she had problems with her heart and stuff, and but she had the pain in the arm and the fingers and all this, you know, she had all that kind of stuff a lot. And this was different, so I guess I just didn't want to believe, you know, that it was my heart.
Darlene's fast-paced lifestyle slowed down so much she knew it was time to get help.
The time that I finally said it's time to do something was when I was trying to bring my wheelbarrow loads of wood into the house, and I'd have to take a break 3-4 times before I could get into the house, and it wasn't that far of a distance before I could take that wheelbarrow, load it up, and just bring it right on in.
She would stop. You would see a look on her face. It wasn't panic. It was simply a look of distress. I mean, she was having a problem.
A problem very familiar to Dr. Soraya Sammy.
She has a non-ischemic cardiomyopathy. It just means that her heart has become weak from an unknown cause. She didn't have a heart attack. She didn't have any blockages in her arteries. But what she did have was a weak heart that limited her function on a daily basis.
It's just the whole thing's wore out. I guess I overdid it over the years.
In her particular case, she had an EKG that suggested that there was a long time delay from when one part of the heart contracted to the other side and contracted. And so that time delay further made the heart less efficient. I recommended that she get a CRT pacemaker defibrillator. How the CRT works is that with every heartbeat, it will pace both sides of her ventricle at the same time and resynchronize her heart. So with every heartbeat, the pacemaker is working. And then the defibrillator will detect a fast rhythm, and if it does not terminate on its own, then it will try to pace the rhythm out, and if that does not work, it will provide a shock to terminate that rhythm.
So I was kind of surprised that she was going to be able to fix this, and I wasn't even 100% sure how good it would get. But I figured anything was better than what I was doing now.
Darlene was in surgery for a few hours. She rested at home for a couple of weeks, and then she was ready to go.
After that, I went back pretty much to doing anything and everything that I could.
Well, she's doing very well. She's just as contrary as she was before. It didn't fix that, but it did fix her activity level. So she still doesn't ride horses, but she does chainsaw and works hard in the garden and digs and paints and climbs ladders and does all kind of things that I think are just terrible, but she loves doing them.
I'm totally amazed today at the difference that it makes. I feel this has given me a lot, an awful lot more life. I can still do mostly everything I did before. This is my kind of life.
And at 73, Darlene keeps going. She says the CRT has really improved her life, and as you can see, it has allowed her to keep up the hard work. Chuck?
Deborah, I don't think I could keep up with her. That was amazing to see what she was able to do. And now joining us is electrophysiologist Dr. Erica Penny-Peterson. And Doctor, I want to ask you, we're talking about rhythm disorders. What can cause something like that, what you saw with Darlene?
Well, like with Darlene, patients that have structural heart disease, meaning coronary artery disease, valvular heart disease, and even congenital heart disease can cause abnormal rhythms. And patients who don't have coronary artery disease or structural heart disease can also have abnormal rhythms. Some of the predisposing risk factors would be like uncontrolled hypertension, obstructive sleep apnea, and those type of things.
Now, to a layperson, would I call that a heart attack, or am I wrong saying that?
They're actually different. A heart rhythm disorder is an abnormal rhythm which can cause the heart not to work efficiently or effectively, whereas a heart attack is caused by blockages in the coronary arteries or the blood vessels, which limit flow to the heart muscle.
Now, besides the device that was inserted into Darlene, talk about something, other devices out there someone might use.
Well, mainly we have two types of devices, one being a pacemaker, which is used to keep the heart beating at a normal rate so that the heart can supply adequate blood flow to the body. The other one is a defibrillator. The defibrillator, which some people may call a shock box, is used to treat abnormal rhythms which could potentially lead to sudden cardiac death.
All right, so you talk about, how does that actually work though with the heart when you put the defibrillator? What's that do?
It has a sensor, and so at all times it's monitoring your heartbeat. And when it senses these ventricular rhythms, it delivers a high energy shock which can terminate the abnormal rhythm.
When I hear shock, is that painful?
It's not pleasant. Most time patients are typically unconscious prior to receiving the shock, but in certain patients who have had shocks, there is another type of mechanism that we use called anti-tachycardic pacing, which tries to pace the patient out of the rhythm prior to getting the shock. But if that doesn't work, then ultimately they do get a shock.
Are there other methods available for managing that heart rhythm disorder?
That we do have very many things that we use to manage heart rhythm disorders. One, of course, would be medications that would control the heart rate and keep people in the normal rhythm. Other things that we can do is invasive type of procedures like electrophysiology studies where we try to investigate the patient's conduction system and try to elicit those abnormal rhythms, so ultimately we can do an ablation and try to cure the patient of their rhythm disorder.
Sounds good. Thank you for joining us
Thank you,
tonight, Doctor. I appreciate that. And it's time to check back to the ABC 27 call center. Deborah, again, it's busy over there. I can see it.
It is very busy, Chuck. Thanks. Here is another viewer question. My heart beats fast a few times a week, but when I go to my doctor, it acts like a normal heart. What should I do?
Certainly, it's not uncommon for patients to have symptoms related to their heart that are very brief and transient. I would encourage this patient to bring their concerns to the attention of their healthcare provider at the time of the appointment, even if they're not experiencing those symptoms during the visit.
Okay, great. Thanks so much. Once again, the phone lines are busy, and if you can't get through, you can email your question right now during the show to questions@abc27.com. We will be right back with more viewer questions right after this. Stay tuned.